Hello everyone, this is Mental Health for Life channel. This time we're going to talk about what schizophrenia is. Do you know the 2001 Academy Award-winning movie A Beautiful Mind? The film is a biographical drama about John Nash, a mathematician who won the Nobel Prize in Economics for his game theory. The movie is described from the view of Dr. Nash, but in the middle of the movie, the audience is shocked to learn that all the scenes are just his hallucinations. Dr. Nash was suffering from the disorder schizophrenia. Many of you may think of schizophrenia as a dreadful disease. You may have conceptions of it being a serious illness that results in hallucinations and delusions, and as it advances, it drives the affected towards total apathy. However, the symptoms can range from mild to severe, and people with mild symptoms are high-functioning and are actually active in society. Especially recently, the number of people with only mild symptoms is likely increasing. Why schizophrenia is called a split mind is because the person with the disease is in a state where the function of the brain which connects the thoughts and emotions is impaired. Someone else's voices or thoughts come in and out of their mind, and they cannot put together what is going on inside of their mind on their own. This state is called schizophrenia. The hallucination of schizophrenia is more frequently experienced auditorily rather than visually. That is, people more often hear things rather than see them. In the Bible, it is written that Jesus Christ and Moses heard the voice of God. Spiritualists say that they can communicate with dead people. Then, what separates people with schizophrenia from such religious figures and spiritualists? For people with schizophrenia, it becomes difficult to distinguish reality from hallucinatory voices or thoughts. The hallucination overwhelms them, and in the end, it can begin to interfere with their lives completely. The characteristics of auditory hallucinations vary from person to person. Some may suddenly hear a voice only when they are at a loss, and others might hear someone all the time from dawn till dusk. The hallucinations can just be casual conversations, or they can be pleasant ones. They may sound familiar, like their deceased mother speaking to them, or the voice might offer advice in the midst of tough situations. The most frequently experienced hallucinations are a voice that speaks ill of the person or about the stuff they care about. For example, when they fail at something, the voice might say, "You are so worthless." When they are concerned about their appearance, the voice might say, "You look terrible." If someone hears these kinds of evil voices all day long, that person would end up feeling plagued, and it might even lead to a serious situation where they develop suicidal thoughts. Also, some may believe their auditory hallucinations are real voices and become suspicious that somebody knows all their secrets. This then advances to paranoia, in which they believe someone is watching them, spying on them, or reading their mind. The factors that contribute to the onset of schizophrenia are believed to be tied more to genetics than to upbringing. This has been investigated in some research studies that have observed twins with schizophrenia. Twins are often raised in the same environment, and one key difference is how identical twins share the exact same genes, while fraternal twins only share half with one another. When one of the twins developed schizophrenia, the other one was observed to see if they also developed the same disorder. It turned out that 30% of the identical twins both developed the disorder, while only 10% of the fraternal twins did. The effect of genes and environment was statistically calculated from these studies. The data shows that the genetic factor is responsible for 70% of the cases and environmental factors only 30%. Innate factors affect people at more than double the rate upbringing environmental factors do. The exact cause of schizophrenia is still not yet fully understood either. However, there are some models that help us to understand their hallucinations. One of these models is sensory deprivation experiments that were popular in the 1950s and 60s. Sensory deprivation is the practice of minimizing stimulation to the senses. For instance, there is what is called an isolation tank, which is a pod that blocks out all sound and light, and in it contains hyperdense saline water kept at a temperature equivalent to the body. The patient will then be put in there just to float still. When this level of sensory deprivation is experienced, about half of all people start to hear or see some sort of hallucination. This suggests that the hallucinations of schizophrenia might be induced, as those that suffer from it may have less stimuli present in their potentially isolated real lives. In fact, people who are introverted and poor at socializing, or those with Asperger's syndrome, are much more likely to develop schizophrenia. Another model we can use to understand these hallucinations is the alteration of the brain with psychoactive agents such as amphetamines. Psychoactives activate the dopamine secretion in the brain and arouses the brain, which leads some people to experience hallucinations. The effect of psychoactive substances is temporary, though it suggests that schizophrenic people are manifesting similar phenomena in their brains. One common view present in brain science theorizes schizophrenia triggers an increase in dopamine levels in the brain is then unable to recover to its normal levels and remains stuck in a state of arousal. If psychoactive substances can create similar conditions as schizophrenia, it can be deduced that we could remedy schizophrenia with some agents that might counteract it in some way. So it was that chlorpromazine was discovered in 1952, which was the first antipsychotic drug. Since then, many types of antipsychotic drugs have been produced. These drugs are used in the treatment of schizophrenia, as it does not merely make the hallucinations go away, but also has the effect of elevating motivation and mood. Schizophrenia is a mental illness, but it responds to antipsychotics quite well, so medication is the primary treatment. Counseling that explores deep into the patient's minds makes them mentally imbalanced and has a risk of making their condition worse. When those who suffer from schizophrenia are treated with medication, social skill training aimed at improving their interpersonal relationships is often recommended in conjunction. This was the Mental Health for Life channel. If you liked this video, please give it a thumbs up and subscribe to our channel.